Hi, everyone. This is Beth Rogan. I'm the Associate Director of Marketing and Outreach for William James College. And I'm really happy to introduce you today to our Careers in Substance Use and Addiction Counseling online information session. So this is really a first for us to have this webinar and to be able to really talk about this particular area of emphasis. And so we have our expert John Meigs with us. And we also have admission experts as well. So I'm really happy that you have joined us today and that you're interested in this very important area of mental health and counseling. So I will be acting as your host today. I'm going to just be providing a little bit of an overview about William James College and also managing the questions. And also would like to introduce, although they will tell you a little bit about themselves as they come on, Dr. John Meigs, who is a teaching faculty member, and he is also, so he is a faculty member in the BS in Psychology program and the Master's in Clinical Mental Health Counseling program in psychology at William James College. So we're excited to have him speak about this very important topic. And I'm the Associate Director of Marketing and Outreach, and Joseph Lush is going to be talking with us a little bit later on about things to think about in applying to graduate school and specifically William James College. And Joe is also helping us on the tech end today, so thank you so much with that. And we'll move on to our next slide. So this is an overview of William James College. It's just like a facade picture. And I love it in the sense that it really helps to really talk about what's happening inside the building. We have a wonderful and amazing culture here at William James College. We have practitioner, faculty, professors, so they're out there practicing. They bring with them so much expertise and mentorship, and our students are amazing. So I'll show you a little bit about some of the programs we have here in a few minutes, but it's a very, very vibrant place. We are a school of psychology and behavioral health. That's what we do. That's our niche, and there's just so much happening here around that. So these are our core values. It's very important, I think, for you to see this slide because it really gives you a sense of us as an institution and what's really important to us. Experiential education is one of our hallmark, really, and how our students are educated and learn, and the pedagogy here and the model of education. So it's an applied model. So students basically are being introduced in their practicum or their field placement, as well as their academic setting, and a seminar class really bridges the two. So in most cases, that's how it works with all the programs, but essentially the key component is you're applying what you're learning in the classroom to your experiential education or your field placement. And that's a really powerful model in terms of experiential education. Social responsibility is key to our mission here at William James College. We really look to how we can meet the needs and make a difference. And how do we do that? Well, we do that by looking at servicing underserved populations and equipping our students to become culturally competent and trained to work with those populations. With that, we have several areas of where we do look to concentrate. I'll talk about that in a minute. Again, that is something that we are also looking at when we look at this very important area in concentration, because it is an underserved area where we hope to train more clinicians because there's just such a tremendous need. Personal growth is something that is extremely important to us here, and of course would be to anyone who is potentially looking to be a student at an institution. You are not a number here at William James College. As I mentioned, our practitioner faculty. With that, we have a 1 to 12 ratio. So that means each faculty member has about 12 or so students that they're advising. So you're very well known to the faculty. We have nice small class sizes. And again, we have that seminar class that is bridging the two between the academic side and the field placement side. And I guess we can move on, except I do want to mention again that we do have a very strong commitment to diversity and inclusion, and as I mentioned, social justice at William James College. And we have programming through our Center for Multicultural and Global Mental Health, where we provide concentrations around global mental health, Latino mental health, Asian mental health, Caribbean and African American mental health, veteran psychology. We have Black Mental Health Academy. So those areas are really some of the areas where we look to, again, equip our students to be culturally competent to serve underserved populations. Moving on to the question box. So this is great. This is a really important piece for you all to hear because we want you to ask questions. It's important. This is what makes the webinar your webinar because it is live. So please don't forget to ask your questions. Any question is a good question. And I'm sure there are others who are participating today that would appreciate your questions. So please do that. We also have some information for you in the handout section. You'll see the PowerPoint, and in addition, I think Joe has included our application guidelines. So those are some things that you can download in the handout section today. And without further ado, I'd like to introduce Dr. John Meigs.
Thank you very much, Beth. It's wonderful to be here. Welcome everyone. This is the first time I'm doing a webinar like this, and this is an exciting time to do this webinar because the substance abuse and addictions emphasis at William James College is fairly new, and Beth talked about kind of one of the commitments of William James College is meeting the need, and there's a huge need for substance use and addictions treatment here in Massachusetts, but also across the country and globally as well. And also kind of the commitment to serving underserved populations. So as I'll talk about a little bit in this presentation, substance use and addiction cuts through all demographic and socioeconomic factors, and it really is it really is kind of represents kind of a significant issue within a lot of communities that we work with as mental health professionals. A little bit about myself. So I am a graduate of William James College. I attended the master's in clinical mental health counseling, the program that I teach in. And I also attended the clinical psychology program. That's how I got my doctorate. So I attended both of those programs at William James College. But prior to coming to William James College, I completed coursework to be a licensed addictions counselor in the state of Massachusetts. So the licensed addictions counselor is a certification that you can receive in order that will prepare you in order to do substance use counseling. And I started out doing that, but I recognized that I wanted to kind of learn more about how to be a good therapist, what good psychotherapy is. How can I use kind of some of the tools of psychology, the kind of different theories that are available in psychology to help me work with the patients that I was working with, who were mostly where substance use and addictions was a big part of their presenting problems. And so that's kind of how I come to this field. And currently, right now, I teach in many different programs at William James, not just not just teaching kind of substance use and addictions programs, but also other programs like ethics and research, where I try and infuse a focus or an emphasis on substance use treatment within those different domains. Oftentimes, substance use treatment has been kind of, we use this term siloed. And what that basically means is kind of substance use treatment is kind of disconnected potentially from kind of the wider the wider treatment landscape. And a big part of the emphasis for substance use and addictions at William James has been to try and kind of get out of that silo, try and create more integration with other types of treatments, other types of providers. So graduating from William James College within this emphasis in substance use and addictions will hopefully prepare someone to be a competent clinician who can work within an interdisciplinary team of other professionals who treat substance use and addictions. And I'll kind of talk about kind of what those different avenues are. So substance use and behavioral addictions, right? So let's think about a little bit about what the need is. You're all likely aware of the opioid epidemic that this country is facing. It's especially intense here in Massachusetts. But substance use and behavioral addictions account for a large number of the patients who receive mental health care. I don't have any kind of data or figures in front of me. I probably should put them on the presentation, but that's okay. But for a lot of clinicians, substance use, so problematic drinking, problematic drug use, and even behavioral addictions such as gambling, those issues tend to be a big part of what people experience when they seek mental health care. Like I said, substance use cuts across all demographic and socioeconomic factors, and good mental health care really does rely on the provision of competent and evidence-based substance use treatment by qualified professionals. And so, again, the main point of the emphasis here at William James is to train clinicians to be competent, providing good psychotherapy, whether that's individual, group, in order to effectively treat someone who may be presenting with a substance use issue. And there are many different ways of approaching this issue. There are many different theories. There are many different treatment techniques. So it's important that the competence here really speaks to the importance of clinicians kind of knowing how to treat the person in front of you. So let's look at some of the data coming out of the United States right now. So according to SAMHSA, which is the Substance Use and Mental Health Service Association, an estimated 24.6 million individuals aged 12 or older were current illicit drug users in 2013. So this data is a little bit old, but I think it speaks to a big part of what the need really is for substance use treatment here in this country. This includes 2.2 million adolescents aged 12 to 17. So this is an issue that obviously affects adolescents and adults. 60.1 million individuals aged 12 or older were past month binge drinkers, including 1.6 million adolescents. And an estimated 21.6 million individuals aged 12 or older had a substance use disorder in the past year. So the bottom line here is 2.5 million received treatment, meaning 20.2 million individuals needed treatment for drug or alcohol use problems. And we can kind of speculate or hypothesize around why people may not be receiving treatment, but a big part of it potentially is sometimes the lack of competent mental health professionals who are out in different communities being able to provide good treatment. Oftentimes, substance use has been viewed, going back to kind of the silo idea, as something that's a little bit separate, right? And so we want to train clinicians who are competent and able to treat anyone who kind of walks through their door, basically. So next slide. Okay, let me just take a glass of water here. So what is substance use and behavioral addictions? We think of substance use and behavioral addictions, and this is how it's defined in the DSM, which is what we use to kind of determine how we diagnose an individual. But we think of that as problematic use of substances, and this can include alcohol, it can include opiates, it can include cannabis, marijuana, stimulants, hallucinogens, any type of substance that has kind of an altering effect. This can also include tobacco use, vaping, and caffeine use. Vaping is actually something that's we're kind of learning a lot more about, and how to help someone curtail their use or stop their use. Gambling is also a behavioral addiction, so that's something that's included in DSM-5, which is what we use to diagnose right now. And gambling is right now a formal diagnosis, and so it's interesting to look at kind of here in Massachusetts. We have a brand new casino in the Boston area, so these issues don't necessarily go away. They continue to persist, and so it speaks to kind of the importance of having competent counselors who can treat any number of these disorders. Another important thing to think about is these disorders don't occur alone. We have this conception of co-occurring disorders, right? So it's this idea that you may have an alcohol abuse problem, but you're also kind of dealing with a potential other diagnosis like post-traumatic stress disorder or depression or significant anxiety, or potentially maybe another disorder like a bipolar disorder or something like that. So we want to be mindful of how disorders interact with each other and how they can potentially impact someone's problematic substance use behavior and problematic substance use. And so treatment is really geared towards meeting kind of whatever it may be, whatever the individual may need. Other behavioral addictions can include problematic engagement with food, sex, social media, gaming, etc. So behavioral addictions aren't necessarily included in the DSM, but anyone who's tried to give up a habit or change some of their behavior, you can really kind of acknowledge how difficult that can be. And when we add in some of the chemical changes that happen, and kind of the life changes that are necessary to kind of change someone's behavior, it can be really be a complicated process. And that's why the need for competent but also evidence-based treatment is so important. Social media is actually going to be an important kind of new thing to explore in the field of substance use counseling. So, all right, so moving on. Substance use treatment really is a dynamic field, and there's multiple opportunities for treatment. So what is it that substance use counselors actually do? You're working in a range of different community settings, whether that's a hospital or a clinic, a community-based program. There's also places for substance use counselors in school-based programs or direct kind of focused substance use treatment programs, basically anywhere where someone is likely to have a substance use disorder or behavioral addiction as part of their presenting issue. There's a need for a mental health counselor in those environments. Just treating. So for instance, if you're just treating someone's depression, right, but they also kind of have an underlying substance use disorder, you have to treat both of them at the same time in a lot of situations. So being able to treat both of those disorders at the same time is really important. And currently, the most evidence-based kind of take on treatment of substance use disorders is what we call the continuum of care model, where again, getting away from the traditional kind of silo idea, substance use treatment is treated by kind of an all hands on deck approach. So you have medical doctors who are involved providing medically assisted treatment. Sometimes that's methadone in the case of opiate use disorders, Suboxone as well. You have kind of peer resources. You have community-based resources such as the 12-step programs, smart recovery programs. You have kind of recovery coaches and sober communities, and then you also have you also have the clinicians, the people who provide kind of individual or group psychotherapy. And so being able to kind of work as a team is a really important thing for substance use treatment, because you want to kind of create an environment and a community where the individual who's receiving the treatment is able to to feel kind of an element of support, an element of accountability, and learn kind of important skills that will help them change their potentially problematic behavior. Another really important chain in that continuum of care is the family. Families play a huge role in someone's recovery from substance use, and we want to kind of bring the family involved, if possible, into someone's treatment. And so that also speaks to the importance of training competent clinicians who are able to work with families and potentially do group psychotherapy and family therapy and reflect on some of the complexities that people may experience in their history of use. There's also kind of opportunities for doing substance use treatment as part of a general private practice, or an outreach or a social service-based program. So really kind of going back to kind of what Beth was saying and kind of the whole the meaning sometimes of William James College is trying to meet the need. And substance use in particular, there is a huge need across the country. And one of the goals of this emphasis is to kind of like provide training for clinicians to become competent clinicians who can treat substance use disorders. Next slide, I think. Yeah. So, what do substance use counselors actually do? They're trained to provide individual, family, and group psychotherapy to individuals in treatment. So I mentioned kind of the importance of having the family involved, but you're trained to kind of use a multimodal approach. There's many different treatments, and the different treatments are tailored, and the different techniques are tailored to reflect kind of the complexity of someone's experience. So there are many different models, and we want to kind of take into account the type of substance that the person may be using, their history of use, whether or not the family or community can be involved in their treatment. What role does the family and community also play in kind of creating or reinforcing sometimes their use, and what it's like to kind of change from that. We also want to take into account their culture and identity, and the history of trauma and other co-occurring disorders. Trauma is a huge issue within the substance use treatment world, because people who experience trauma, the substance use is in some ways a way of self-medication, and so it's a very powerful way of doing that, but it leads to kind of significant problems later on in life. And so a big part of treatment is about kind of developing coping skills, helping someone acknowledge the impact and the role that substance use may have on their life, and trying to kind of provide treatment that addresses some of those complicated ways of coping with issues. So next slide, yeah. So treatment methods typically rely on the counselor being able to adequately assess the individual and provide culturally competent care. And this is true for any clinician. So one of the benefits, I think, and one of the reasons why I wanted to attend William James College and kind of pursue a higher degree was I felt competent providing kind of focused substance use care, but I wanted to kind of also know, like, what are the other things I need to know in order to be a good psychotherapist? And so, like, I think that's one of the benefits of William James College, is because you're being trained to be a good counselor or a good psychologist, and who can specialize in providing substance use care. So no matter who you're working with, it's really ethically important to be able to adequately assess the individual, adequately assess what their presenting issue is, what prior diagnoses they may have, what diagnoses they have when they present in front of you, getting a sense of their history, also getting a sense of kind of what their culture is, and how culture and socioeconomic factors and demographics play into aspects of their presenting problems. And this can include individual and family-based treatment. So here at William James, we do have other emphasis and other focus on providing family-based care. And so if you were interested in learning how to be a good couples or family therapist, you can kind of in some ways combine different emphases, because what you're doing is you're learning how to provide care to a population that you care about. So some treatment models that we use for substance use include motivational interviewing. That's kind of focusing on kind of what is it that motivates someone? How do we get someone to acknowledge changes they may need to make in their lives, and what are the kind of unique individual aspects that go into someone making a decision. And as counselors, we're not kind of telling someone what to do, we're helping them and kind of guiding them to get to that place where they make a decision that's informed by their perspective, their culture, and their goals in life. We also use cognitive behavioral treatments. So these are treatments that are really focused on shifting aspects of someone's perspective. The old adage of, changing your thoughts have an impact on changing your emotions, which have an impact on changing your behavior. And so a lot of the work we do in substance use treatment is cognitive behavioral based, where we're looking at kind of thoughts, emotions, and behaviors, and doing treatment around kind of shifting some of those thoughts, which have an impact on shifting someone's emotions and behaviors. And then there's also insight-oriented and more person-centered treatments, which I think we do a good job here at William James College of focusing on kind of the humanistic aspects of substance use treatment. So getting into treatment, going through treatment, the recovery process can be a profoundly life-changing experience. And part of that is the grief someone may experience of having to kind of completely shift important aspects of their life, having to change how they view themselves, having to shift kind of aspects of their identity, having to say goodbye to people and places they may have known, because those people and places may not be good for their recovery in some ways. So in some ways, there is a grieving process associated with recovery, recovery from drugs or alcohol or behavioral addiction. And as clinicians, we can sometimes kind of be with the person as they go through that process of grief. So one of my goals with this emphasis is to not only focus in on the real kind of evidence-based treatments targeted for substance use, such as motivational interviewing and cognitive behavioral therapy, but also think about some of the more insight-oriented, person-centered treatments that really allow for someone to reflect on the significant aspects of their experience, sometimes kind of the more existential aspects of treatment. And with substance use, that can have a profound effect, because relapse rates are so high, because success is measured differently in the substance use world, where there's many different relapses. People come and go through treatment. Success rates are fairly low in terms of someone maintaining kind of consistent sobriety. So helping to process some of those experiences from a humanistic existential stance is also important. But overall, the goal is to train clinicians to be well-rounded in how they treat the populations that they serve with. So that's actually a good shift into who are the populations that are served. So like I said, substance use cuts across all demographic and socioeconomic categories, and substance use counseling is needed in most communities. And so one of the benefits, I think, of training at William James College, or training for potentially a more advanced degree with a substance use emphasis, is it allows you to have some perspective on a specific population that you may be interested in. And here's just a list of some of the different populations that you're more likely to work with. But each of these populations have different cultures, different aspects, different histories that you always want to take into account when you're providing kind of substance use treatment. So a lot of my work has actually been with veterans, and so working with veterans, it's important to know kind of aspects of their military experience, what that was like for what that was like for them, what role that alcohol or drugs played in their service, whether they were deployed or not deployed, checking in kind of on the different generational aspects. If they, Vietnam veterans, their experience was profoundly different than the current OEF, OIF veterans. So it's important to kind of, as a substance use counselor, kind of know and be culturally competent with working with any of these different populations. And you can notice there's substance use cuts across all these different kind of population factors. So and I'm sure you can think of for yourself kind of what are some other populations that you may see, and it's likely that the population that you're interested in serving has a substance use issue within that population. I'm also a graduate here at William James, the Global Mental Health Program, and globally, substance use is a huge problem across the world. That's often kind of looked at from a different perspective, and so that's also something that we talk about or think about here at William James as well. So what are the career paths for a substance use counselor? So I've used the term counselor. Typically, counselor, therapist, psychotherapist, they're fairly similar. You can be a licensed alcohol and drug counselor. So that is a process of applying for a specific license through a state agency. Here at William James, we're on that second bullet point. Learning how to be taking classes and gaining expertise in being a licensed clinical mental health counselor. Counselors are part of an interdisciplinary team on direct treatment, and level clinicians are often clinical or program directors of substance program, halfway house, for instance, or a more community-based treatment program. And these are programs that are all throughout the state, all throughout the country, that really do need the benefit of competent clinicians working in these programs. But counselors can also be involved in advocacy efforts to destigmatize seeking treatment and also working towards policy changes. So you can do this as a licensed mental health counselor. You can also do this if you're interested in the clinical program here at William James. You can do this as a clinical psychologist, but also school psychology, even organizational psychology. There are ways of accessing the impact that substance use and addictions has on a specific kind of community or program. So next slide. Yeah. So what are the training options? So William James, we currently offer an emphasis in substance use and addictions counseling. And what that means is the courses are taken in conjunction with the general counseling program. And students graduate with a background in substance use counseling and meet the license requirements for a licensed mental health counselor in the state of Massachusetts and other states as well. It's just important to check what state you'd be working in after you graduate. A background in substance use counseling will allow the graduate to apply for substance use specific programs, both clinician and administrative roles. So again, this program is training for the licensed mental health counselor, licensed mental health clinician, licensed mental health counselor license here in Massachusetts. Next slide. So let's look at kind of what actually happens here. So the general courses in clinical mental health counseling, these are just some that I kind of pulled off the top of my head, but ethics, research, theories of counseling, lifespan development, group psychology, psychopathology, assessment. There are other ones as well. This is definitely not a definitive list, but this gives you an idea of you're getting a strong background in what it means to be a counselor, what it means to be a mental health counselor and provide treatment to someone. And then you're also getting additional courses with a focus on substance use counseling. So those additional courses are the community and family treatment, looking at kind of the role that someone's community and their family play in treating them within a continuum of care model. And then also approaches to comprehensive addiction treatment, which is kind of a a class where we look at kind of what are some other issues that it's important for a substance use counselor to be aware of, or a clinician to be aware of when they provide substance use counseling. So we look at issues specific to vulnerable populations. We look at culture. We look at also kind of popular culture perception of substance use. We look at kind of how that impacts stigma. And we kind of look at both kind of the broad ideas around kind of conceptually how what role substance use plays in someone's life, and then also get into the nitty-gritty around like here are specific types of treatment that you can use. Another course that should be included here, I think, is the trauma course, which is a course where we focus in on kind of what is the role, what's the role and impact that trauma may have on someone's life. How do we treat trauma? How do we treat PTSD and other co-occurring disorders and how it impacts someone's substance use treatment. So next slide. And the training here at William James also includes field education at a clinical site with an emphasis on substance use counseling. And so when you're in your field education site, you receive supervision from a clinician experienced in substance use treatment. And so we have various sites that treat substance users, and you would be able to kind of have one of your field education or potentially both of your field education experiences in that environment. And that's really one of the best ways of learning how to do competent treatment is learning from the people who actually are on the ground kind of doing it. One of the other benefits of William James is all the faculty are also practicing, or most of the faculty are practicing. So I have my own private practice where I see predominantly working individuals who also have a substance use issue, and so that's kind of a population that I'm working with right now. And so I take a lot of that information, a lot of that experience into the classes that I teach. So when I'm teaching ethics, for instance, I'm also bringing in kind of how substance use kind of impacts ethically appropriate treatment. So next slide, I think. So my experience, so this is just giving you an idea of kind of my experience in the field of substance use treatment. These are all kind of the different settings that I trained at. So I'm a clinical psychologist, so I had more years in actual training, but I started out working at what's called a transitional support program, which is basically if you imagine kind of a rehab program where someone is living in the program for a few months, and kind of all the focus 24 hours a day or most of the time during the day, during the week, is on early recovery, helping someone process their experience and get into the next steps of their treatment. The next step of the treatment is typically a halfway house. I've worked in programs where people are living after their initial detox from substances, where they're trying to kind of reintegrate back into the community, learn how to kind of continue to use the coping skills that they may have learned in the TSS program or the detox center, while also continuing to repair relationships they may have had, learn how to live from a sober perspective, continue to attend 12-step meetings or other community meetings. And I've also worked in hospital settings, community-based clinics, college-based mental health services. That's another big area for substance use treatment, because here in America we have a college sometimes equals binge drinking, so a lot of substance use issues kind of develop potentially in college, and so that's definitely an area of need. I've also worked in a VA hospital, which is also kind of an important place of providing good substance use treatment. So, and yeah, so that's all I got. And I hope there's some questions. I'm happy to answer any questions you may have, but I hope I was able to give you kind of a good kind of overview of what the program is, what the need is, and what would it be like to kind of like learn how to do substance use treatment here at William James.
Great. Thank you, John. So we do have a couple questions, and then this is where I'd like to just really encourage folks to continue on with their questions. And then we also want to have a chance for Joe to talk a little bit about, thinking about the admission process and so on. So one question is, so in terms of, there's a specialty of substance use and addiction, but then the other term would be, the other thought is, you are then trained as someone who would be a generalist or could take care of various populations and treat others as a licensed mental health clinician. So if you could just kind of speak to that a little bit.
Yes, absolutely. So yes, you're the training and the classes meet requirements to be a licensed mental health counselor. So you are trained in some ways to be a generalist. There's no obligation necessarily to treat substance users, but this emphasis allows you to gain a little more expertise, or a lot more expertise in doing substance use counseling. Traditionally, graduate programs in psychology would only offer, and this is true for William James, only offer one elective course on substance use, which is okay if that's not really what you're interested in. But I would argue, because substance use really does impact most people that you'll work with in the mental health field, even if it's not their primary problem. They may have had a history. Maybe their father or mother had an issue with alcohol, or a grandfather or something like that. Knowing about substance use, having some level of expertise, allows you to be a much more competent counselor. But yes, you can be a generalist, and with kind of an additional expertise or emphasis in substance use treatment.
Oh, great. Okay. Um, this is just a comment from Alice, which I thought was nice. She says, not a question, but I'm so happy about the fact that you use the term relapse instead of failure.
Yes. Yeah. So that's we always want to be mindful of the culture of recovery, and relapse from a psychological perspective, and from a disease perspective. It's part of the process. Think of other symptoms, like symptoms of anxiety. They go up and down all the time, and so the same is true with substance use. One of the things that's unique, I think, about substance use is kind of the moral aspects that's kind of laid on it from American culture or other cultures as well. And so we want to kind of counteract that in order to reduce some of the stigma around relapse, around seeking treatment, around someone like feeling kind of shame associated with their use. It's a disease. It's a significant problem that we can treat in a much more humanistic way.
Yeah, I think that's a really helpful to frame the philosophy there. We have Sadia is someone who's basically saying she's interested in this program. She's done a master's in clinical psychology and working in an addiction rehab center since a few years, and she needs a solid theoretical and practical knowledge as she's doing addiction counseling
Mm-hmm.
on the basis of her clinical skills. Thinking this sounds like someone who would be a good fit, but I wanted to just bring this to you. I don't know if it's really a question, but it's more of an individual question, and it's something also that maybe Joe can address a little bit in terms of the application and transfers and things like that for credits, maybe. I don't know if you have anything to add to that, John.
So just to clarify, is this someone who already has a license and is already practicing?
Doesn't say a license. It's done a master's in clinical psychology and working in an addiction rehab center.
Okay. Yeah. So this is definitely, you want to be mindful of like what license you're going for, because like this program like will also include kind of generalist counseling and psychology academic criteria as well. So you wouldn't want to kind of like, if you already have a master's, you wouldn't necessarily want to double up on that. But depending on kind of like what license you're using to practice, this will this program can definitely add to your overall expertise of providing substance use treatment. So.
Okay. And that might be a good way to sort of say, if you have very personal questions like that or individual, then you can, talk to our admissions folks. But I think she was mentioning that she wants to have a license too in this field.
So, yeah, because there are many different there are many different like licenses that are out there, and so or different masters as well. So this program in particular would allow you to get that license, but it's a master's level license. There are other programs, and we're working on getting the licensed addictions counselor license. We should be rolling that out within the next year or two, but that's a little bit different.
Okay. Okay, great. So I think right now we can move on. And we just want to take a quick poll here. And when you would plan to start graduate school, would that be 2021 in the spring, so in January, or the fall, or you're undecided? So if you could just let us know that, that would help us as we're moving forward to address some questions and provide some information. Okay. Okay. And that will just take a minute or so. We will, okay. So it looks like almost 70% of you are interested in the fall of 2021, and the rest are undecided. So that's great. That's helpful. And then we'll move on now so Joe can talk a little bit more.
And thank you, Beth. Welcome, everyone. My name is Joseph Lush, Associate Director of Admissions here at William James College. And so for those of you attending today who might be considering an application to William James College, especially for the substance abuse and addictions training that we offer, I just want to offer a brief overview of the process that you would follow for becoming a student in this program of study. And I'll also outline for you some basic tips on how to navigate the screening process and how to prepare a strong application portfolio. So before we talk about the basics of preparing the application portfolio, I just want to offer a quick overview of the key measurements of readiness that we consider when evaluating the credentials of a candidate. So, regardless of the program that you choose, whether it's a program that focuses on substance abuse counseling or some other area of human services, I think that there are several common characteristics of a successful candidate for admission, and these include a high level of personal commitment, a high level of energy and active participation, both in the classroom and also during the field experience, and also having a positive attitude, or perhaps a better word for that would be an affection for the amount of reading and writing that would be expected of you in a training program such as what we offer. Good work ethics would also be important. And also, we're looking for candidates that have a professional and respectful demeanor. So if you think back on what Dr. Meigs said earlier about how we endeavor to train our candidates to offer culturally competent care, this translates to interpersonal skills, which would include a student who is capable of being able to establish rapport, not only with their coworkers at the mental health agency that they're working for, but also with their clients. We're looking for students who are good listeners, students who are capable of exhibiting a measure of empathy. And also we're looking for candidates who are comfortable with working with other clients and individuals who come from different socioeconomic backgrounds other than their own. So these are all elements of having a professional and respectful demeanor. So admission to most of our academic programs basically involves a two-part screening process. Beth, did you want to say something?
Joe, I don't think the slides have been moving forward. We're
Oh,
still on the poll, so I just thought
oh,
maybe you
I'm
might
sorry.
want to, yeah.
Yeah, let me see if I can fix that. How's that?
Yeah, that's great.
Sorry about that, folks. Yeah. Um, so admission to most of our academic programs basically involves a two-part screening process. And the process begins with an initial screening for academic readiness. So this is where your application portfolio comes in. And on the next slide, I'll actually talk a little bit about the components of the application portfolio. So the common measurements of academic readiness will be the candidate grade point average, also the overall strength of the application essay as it relates to grammar and sentence construction, and also to the extent that the applicant's references endorse the candidate's academic readiness. And for those programs that require an interview, and the program that we've been talking about today, the clinical mental health counseling master's program with an emphasis in substance use and addictions counseling, this program does require an interview. This is an activity that also will play a major role in determining the outcome of your candidacy. And it basically provides you, the candidate, with an opportunity to communicate to the interviewer that you have that high level of commitment to completing the degree program, and that you have a basic understanding of the professional role that you aspire to become, and that you also have the appropriate level of emotional maturity and the interpersonal skills that are required to be successful in this career. Okay, let's move on to the next slide. And so here is the basic checklist of items that will comprise your application portfolio. And our online application will provide you with a detailed list of all of the documents that are needed for the program that you're going to be applying to. And I would just ask that you check our website, and also you can refer to the handout that I attached to this presentation for the application due dates. So just be mindful of those. And for the supporting documents that you'll need for your application for admission, which will be transcripts and letters of recommendation, these documents can very often be electronically delivered to the college by the sender. And so I'll just wrap up because we have only about 5 minutes left. So I just want to leave some time for some questions. I just want to wrap up with a couple of basic application and interview tips. So because the program that we're talking about today requires references, I just want to say a few words about that. And so you will need 3 references for application to the clinical mental health counseling master's program. So you should definitely approach people who really know you well from an academic or a work or a volunteer setting, and ask them to write a letter of recommendation on your behalf. And with regard to the application essay, this is an important indicator of your academic readiness for graduate study. So it's goes without saying that the correct use of spelling and sentence construction and grammar are all very important, because the essay gives us an important clue as to your academic writing ability. And so you can certainly use your application essay to highlight your academic and your work and your volunteer experiences. And you want to use your essay to build a case for why you wish to advance your knowledge and your skills in this area. And so just by going through that exercise of organizing your thoughts and writing, this is also going to help you to better navigate interview. And I just want to emphasize that here at William James College, we do use a holistic approach to evaluating the readiness of our candidates. And so you should certainly use your application essay to discuss any challenges in your academic portfolio that you feel requires any additional explanation or context. So by that I mean, for example, let's say that you were a first-generation student, or you were someone who changed majors in your undergraduate program, or maybe English was not your first language. These are all situations or settings that may have caused you to have a adjustment period in your bachelor's program. So perhaps you didn't have a strong academic start to your program. So use your application essay to discuss some of those challenges that you had in coming to this point in your training, and try to turn that into a positive and talk about how you persevered and you overcame some of those challenges. And then finally, I just want to end with a reference to the importance that your interviewer knows that you have a basic understanding of the professional role that you're for the training program that you're seeking. And so if you aspire to become a substance use and addictions counselor, definitely become familiar with the basic responsibilities and the obligations that this profession typically demands of you. And hopefully this presentation today gave you a pretty good idea of what some of the scope of responsibilities that is called for in this field. Okay, so with just a couple of minutes left, I want to turn it back over to Beth and John, and we are happy to take any questions that you have.
Okay, I think one of the questions that theme is coming through, Joe, is just can you give any hints around the essay? What would be helpful for individuals to think about when they're writing their essay?
Sure. So we actually provide you with several prompts for you to kind of frame that essay. The typical essay for a application to the Clinical Mental Health Counseling Master's Program is roughly about 4 or 5 or maybe 6 pages. Sometimes I've seen them go as long as 6 pages. And so, again, we give you some writing prompts to kind of help you frame your thoughts, and there's about 8 or 9 of those prompts. And I would just say generally to think about academic and professional or volunteer and even some personal experiences that you had coming up to this point of applying to this program, and kind of think about all of those experiences that you've had in the classroom, in the workplace, or maybe in a volunteer setting, and just try to build this logical case for why this training program will help you to achieve the next phase of your professional career. And I would add to this that for any of you who would like to have a critique or to have a second opinion of what you want to submit for your essay, I'm happy to look at a draft of that essay, and I would love to collaborate with you and to give you some input as to how you might be able to strengthen and improve that.
Great, thank you, Joe. I think that's it for our questions now. So thank you everyone for all your questions. Do we have another slide? Maybe a slide with
Yep, I
Okay, great.
just want to end here by just saying that we are currently accepting applications for spring 2021 and fall 2020 enrollment. And for the clinical mental health counseling program that we've been talking about today, with the emphasis in substance use and addictions counseling, we do admit students at 2 points in time during the academic year, beginning in the spring, which for us, our spring term begins in January, and then the fall 2021 term begins in late August.
Okay, thank you. And as you can see, everyone, here are some emails and contact information. So again, if you have specific questions for Dr. Meigs about the program and his experiences, feel free to email him. And the rest of us are here. Joe is very helpful in terms of the application process, or just, talking through your interest and in going back to graduate school, and then admissions questions as well. So here is a listing of financial aid if you have questions around that. And we have other webinars that are available, and you can find them on our website as well, under the admissions tab. You can go to webinars and events. Please connect with us on social media. We'd love to have you follow us and be part of the conversation around mental health and behavioral health, and all of the wonderful things that are happening here at William James College as well. And thank you so much for joining us today. I look forward to you continuing to connect with us. Thank you again.
Thank you, folks.
Thank you.
Bye now.
Bye.
All right, so I'm going to log off. Thanks.
Thanks, John.
Yeah.
Nice job.
Thank you. It was fun. Happy to do it again. So.
Sounds good.